In this video, let's talk about better tests to evaluate your cardiovascular risk. What do I mean by that? In previous videos, I explained that cholesterol is not a very good indicator of your cardiovascular risk. Not really good at predicting whether you're going to have a heart attack or a stroke, and I provided the evidence for that. And so if cholesterol is a poor predictor of cardiovascular disease and cardiovascular events, then what tests might be better? In order to explore that, then I think it's important to first understand how plaque in the arteries happens to begin with. How does plaque get deposited in the arteries? What causes blockages in the arteries? It's helpful to understand the process. So if you haven't heard this before, I'm digressing here a little bit, but it's an important piece of learning. And so again, it's not that cholesterol, just because it circulates in a blood vessel, that sticks to the arteries and causes these blockages. That's not how it happens. The whole thing actually is very similar to what happens when you scrape your skin, when you cut your skin, and it bleeds. And so naturally, there are these tiny types of kind of cells, blood cells, not exactly cells, they're called platelets. They rush to the area, and through a series of processes involving different substances, the area, the injury, the site of injury clots, basically, and the clot prevents from the blood to exit, to gush out. And over time, it becomes thicker and thicker and thicker, like scar-like, and a scab is formed. And so that, in essence, what happens to the arteries, except that in the arteries, it's not a physical injury, a physical cut or scrape. It's more of a chemical injury that results from toxins, eating toxic foods, so to speak, usually vegetable oils and things like that, smoking cigarettes, and other types of toxins, either from the gut or from the environment. And the nature of the injury is basically oxidative stress, oxidative damage to the artery wall. But the way the body responds to it is very similar to the way it responds to injury to the skin. And so this thickening occurs to a scab right here. Where is my cursor? There it is. So initially, what's very similar to this happens here. And over time, if it's not healed properly, then fatty streaks can appear both in the arteries, in the blood vessels, and even within the scab as well. And so this is what this yellow hue here represents. That's what it represents. And that's what you see in the diagram here. And so the deposition of fats and cholesterol later on in plaque, I kind of explained it in another video why that happens, but that's not the cause of the process. And so when the whole thing happens, the repair process itself is basically known by a different name. Something that perhaps we associate with something that isn't all too good, and that's inflammation. Inflammation is a process by which material is mobilized through the blood vessels to the area of injury to facilitate repair. And with that, there is some throbbing, there's some redness, there's some swelling, there's some pain. These are the typical hallmarks of inflammation. Its purpose is to repair. And we run into problems if inflammation persists and it doesn't repair, and the situation in the arteries, and again looking for the cursor, just gets worse and worse and worse over time. And so the types of tests that we want to perform in order to figure out whether we're at risk for a heart attack or a stroke would be the kinds of tests that would indicate whether these processes are happening. And so typically it would be tests for clotting and coagulation. And another test is specific for overall blood vessel function, right? So if the artery doesn't heal, its function gets compromised. It's not supposed to do what it is supposed to do, and we'll talk about it later on in a few moments. And so let's run through these tests briefly. And these tests, the reason I like these tests is because they're not outside the box. They're easily attained. They're not exotic tests. They're not the type of tests that sometimes cost a lot of money and you need to order from a specialty lab. These are tests that any physician can order, really. And so the first test, the one that tests cardiovascular inflammation, is high sensitivity C-reactive protein. Now, don't confuse that with C-reactive protein on its own without the high sensitive or the high sensitivity part, because that just measures general inflammation. But the one specific for the cardiovascular system and the arteries is high sensitivity C-reactive protein, and HSCRP is basically an acronym for that. And so I gave you just an example here, a clip from a screenshot from test results from a patient or client I had recently. His CRP was tested, or high sensitivity CRP, came back at 0.5 watt milligrams per liter. And the lab test results even show you the different range mean. And so anything below 1 is low risk, between 1 and 3 is average risk, and over 3 is high risk. So fortunately, although this particular individual has high cholesterol, according to this test, he's at low risk. And so indeed, the scientific literature does support this assertion. And basically, I'll read you, this is one example, one study. You can pause the video, you can look it up yourself. There are many such studies. But the conclusion here suggests that, here it says, we conclude that the serum HSCRP has better predictive value for risk of atherosclerosis than what? Than LDL cholesterol. And another one here, inflammation and cholesterol as predictors of cardiovascular events among patients receiving statin therapy. So these are people that have cardiovascular disease and are taking cholesterol-lowering medications. And in the interpretation section of the study, it says inflammation assessed by high sensitivity C-reactive protein was a stronger predictor for risk of future cardiovascular events and deaths than cholesterol assessed by LDL, supposedly bad cholesterol. Okay, so that's one important test. The next test I really like to order, which is quite telling about what's going on in the blood vessels and whether a person is at risk, is a test for clotting or scab formation, so to speak, and that's fibrinogen. Again, very common test, easy to order, easy to interpret, and basically it's a type of protein that is made in the liver and is involved in the clotting and the scarring process, so to speak. So again, just a snapshot from test results from another client, a woman in her 60s with diabetes, blood pressure, and her C-reactive protein was high, and so was her fibrinogen. It says it's 4.96, and the range is between 2 and 3.9. So this has to be addressed, obviously, and typically excessive clotting and excessive coagulation, which also is another way of saying thick blood. You know how often people talk in terms of blood thinners or needing to make the blood thinner. It's too thick. That's what it is when there's excessive clotting and scab formation. And so that's what it is indicative of, basically. And so what I was going to say is that inflammation drives this process as well. Excessive inflammation that lasts too long drives this process. So treating this really is going to be done by treating inflammation. And again, evidence from the scientific literature, the Journal of Medicine. And what I want to focus here is, again, just to compare the validity and the value in this test to the value of testing cholesterol. So one way of doing that is something called risk ratio. The higher the risk ratio, the greater the risk for something, in this case, cardiovascular disease and heart attacks and so on. So the risk ratio for fibrinogen, according to this study, was 2.24, whereas another study evaluated the risk ratio, or another way of saying it is hazard ratio, of low-density lipoprotein, again, so-called bad cholesterol, and it evaluated it for different amounts and levels of cholesterol, and it found out that the risk ratio or hazard ratio there ranged between 1.4, 1.3, up to 1.9 for different levels of cholesterol. You can pause this and read this yourself. So certainly less than the 2.24 which was the risk ratio for fibrinogen. Again, just a proof that fibrinogen is probably a better test than cholesterol. And then the last test I want to talk about is a blood vessel function test. So if the blood vessels are damaged through atherosclerosis, which is hardening of the arteries and narrowing of the arteries through this scar formation process and all that, then the arteries are going to function poorly, more poorly. And can we evaluate that? So I'm going to answer that question in a second, but basically the short answer is yes, and the test is urine microalbumin to creatinine ratio. Micro means small, albumin is a type of protein, very common protein, as is creatinine. And the higher the albumin and the lower the creatinine in the urine, the more likely or the higher the degree of blood vessel dysfunction is. And so, again, you can actually, this is a snapshot from someone else's test, and the results here are 0.3 milligrams per millimole of creatinine specifically. So the amount of microalbumin was 4, the amount of microalbumin was 0.3. The ratio was less than 3, which means that it's at the normal to mildly increased risk for cardiovascular disease. And if it's more than 3, it's moderately increased. And if it's more than 30, then it's severely increased. So you can actually find out by reading your blood test results where you're at when you test this or any other type of marker. And so why is it relevant? Well, first of all, Wikipedia told us so. Although I don't hold Wikipedia as the arbitrator of truth necessarily, they don't always come through with the best information, but it's probably easier to digest than scientific study. But basically the reason for this, and the reason this test is so valuable and it works well, is because it tests the output of material through the kidneys. And the kidneys are highly vascular, a lot of blood vessels in the kidneys. So if the output through the kidneys is going to be compromised, going to be changed, not going to be optimal, if certain protein that is supposed to stay in the blood is going to be leaked out, whereas other proteins supposed to exit is going to stay in, if that filtration capacity isn't there because the blood vessels aren't working very well, maybe even starting to disintegrate, then it's an obvious sign that there is an issue with the blood vessels in the body. The function of the blood vessels in the kidneys, well, those are just an extension of the blood vessels in the rest of the body, so we can extrapolate from that that's happening elsewhere as well. So it's a good test to see where a person is at, and as a result of that, whether they're likely laying down plaque or not. So these 3 tests are great at identifying real risk for potential impending cardiovascular events like a heart attack or a stroke. Now, having said that, you can have clogged arteries and have no heart attack or stroke. That's possible. You can have like 90%, 95% clogged arteries and have no heart attack or stroke. And you can also have relatively clear arteries and still have a heart attack or a stroke. And how do you explain that? Well, one reason is just the mere fact that usually around the coronary arteries, which tend to get blocked, there are a lot of tiny blood vessels that go around them, so that they may still be open and function just fine. This picture represents there in red, these vessels are the coronary arteries, but around them are these other tiny blood vessels that can circumvent blood flow through the coronary arteries and still feed the blood through. Plus, the heart is just full of blood as it is, so it is possible. And so what else would cause it? What do you need to test to figure out if you're still at risk or not? If your arteries are clear, but you still might be at risk. So the sort of things you need to look for are thyroid hormone and other hormones, sugar metabolism, and if there is an excessive state of stress in your body for various from various causes and reasons. And so this is going to be a topic for another video. I'll talk about that. It's really, really important. These are really important determinants, possible causes of cardiovascular disease and really other types of issues. These sort of things govern our health as a whole. So that's basically it for today. If you feel that you need a different direction with your healthcare, perhaps you're taking too many medications, aren't feeling very well, and you want to get better and you want to do it naturally, then feel free to reach out. If you haven't worked with a naturopathic doctor before, we can have a little chat about that and see whether we're a good fit and I can help you, whether I can help you or not. And so that's complimentary. There's no cost for that, no strings attached. And you'll learn how, someone like myself, who is a naturopathic doctor who focuses on cardiovascular disease and diseases related to aging, work. And as well, if you like this type of content, please like this video, share this video with people you think would benefit from it as well, and subscribe if you'd like to be notified when additional content comes out. Thank you.